Canadian mentally ill patients to get euthanasia in new law. The MAiD law in Canada will be amended on March 17, 2023, making those whose sole underlying medical condition is mental illness eligible for assisted suicide. Under the MAiD Act, a physician or nurse practitioner may, at a patient's request, give medication that willfully causes death. Canada's rising use of medically assisted death for physical problems has drawn criticism from throughout the world. By introducing a bill that will allow mentally ill persons to receive medically assisted death, generally known as euthanasia, it has once again startled the globe. The MAiD law in Canada will be changed on March 17, 2023, allowing persons whose sole underlying medical condition is mental illness to be eligible for an assisted death, according to an in-depth interview done by CTV W5. According to MAiD law, a doctor or nurse practitioner may, at a patient's request, give medication that willfully results in death. Only those who qualify can use this treatment. An 81-year-old former journalist who was questioned by W5 claimed to have started the paperwork for his assisted dying. After 35 years of battling depression, anxiety, suicidal thoughts, and post-traumatic stress disorder, John Scully claims that MAiD will be a relief. He told CTV's W5, "I would probably play some music and die gently. I don't want to mess things up once more. I failed twice in my attempts to end my life." Scully describes him as intelligent and capable. His 3 publications, including Am I Dead Yet?, A Journalist's Perspective on Terrorism, provide the proof. The Canada Supreme Court, the federal government, and Dr. Ellen Wiebe, a Canada MAiD provider, all support his conclusion. Both physical and mental illnesses can result in intolerable anguish, the doctor noted. More than 400 patients with physical diseases have received MAiD from Wiebe. After being provided to those who were suffering from fatal illnesses like cancer, MAiD became a legitimate medical therapy in Canada in 2016. They changed the law in 2021 to cover people with chronic pain and other non-terminal conditions. The government then convened deliberations in May 2022 about whether to cover mental diseases, a choice that they appear to have made. After the patient decides to receive assistance, he or she will be monitored for at least 90 days before a death is announced. The request must be confirmed by 2 assessors. Additionally, the patients will need to demonstrate that they have seriously considered alternative therapies. Scully disclosed to the news organization that he has undergone counseling, been hospitalized 7 times, and taken numerous drugs. Additionally, he has received 19 sessions of electroconvulsive therapy, which uses shocks to the brain to treat depression. He declared from his Toronto apartment, "I have tried every single so-called remedy." To try to control his severe pain and health issues, Scully is currently taking 30 medicines every day. But a group of specialists, led by psychiatrist John Marr, says the choice has to be reevaluated. Dr. Marr told W5 that he recently had a patient with MAiD who wanted to die because he thought no one would ever love him. He claimed that similar accounts of patients in their care asking how to cease therapy and become eligible for assisted suicide had been shared by colleagues. According to Marr, the wait times for our treatment programs in Ontario can last up to 5 years. There are substantial waits for mental health care across Canada, according to numerous studies. The ill will go through cycles. It has some ups and downs. It might take years. After then, there is a spike in illness and suffering, which we then address, according to Marr. For him, MAiD, which treats mental diseases, is too close to suicide. "You're helping someone commit suicide," the message read. "The physician is the clean gun," he said. One of his main worries is how anyone can decide whether a person has a mental condition and whether it is incurable, as required by the law. "I don't dispute in the slightest that some people have incurable illnesses. To prove to me that the person in front of you is who they say they are, I challenge you and everyone else in the universe." 1 in 10 Canadians who need counseling wait more than 4 months to get help. For children and young people, it is considerably longer. Thanks for watching. Please consider subscribing to the channel.